Good evening, everybody. Meeting in the session of Madhya Medica after a gap of 4 5 days. We'll start with today's session with a new remedy that is DROSERA rotundiphilia. Before going into the Allen's keynotes, we'll discuss certain aspects of the remedy. Generally, we can consider this remedy as a cup remedy or whooping cup remedy. But if you understand remedy thoroughly, then you will understand many things about this remedy. It is a remedy from tubercular miasm, having in-depth action on the tuberculosis. And if you go through the Dr. Margaret Tyler's DROSERA booklet, you will find over there many cases treated with the DROSERA of the pot spine. That is nothing but the tuberculosis of the spine. And I have experienced this in my practice also, that DROSERA is a wonderful remedy in order to treat the pot spine. In fact, I have shared this case earlier whenever I have shared the DROSERA before also during COVID time. I was working with Dr. Nitin Bhagli sir as a houseman over there in his hospital in 1990s. And there was a patient who was brought for the quadriplegia and who was diagnosed case of a tuberculosis of the spine, pot spine, with a cold abscess, and he was continuously on anti-tubercular treatment since 4 months. Everyone have asked him to go for a surgery, but everyone have said that even after doing the surgery, we never give you guarantee that your paralysis will settle and you will come out of this situation. And that's why he was only on medication since last 4 months on anti-tubercular treatment with 4 drug regimen. And still he was not at all better. He was brought over there on stretcher completely and not having movement in his both hands, both legs. His at that time MRI was too costly, and even during that time MRI was done 2 3 times, and everywhere they have explained that there is a pot spine along with cold abscess situated over there in posteriorly, and they have consulted many orthopedicians, neurophysicians, everyone, neurosurgeons, and everyone asked them to go for surgery with a caution. My sir, Dr. Nitin Bhagli sir also asked him to go for open surgery, and he directly told them, I will do the surgery. With surgery, I know that there are very less chances he will recover thereafter, but at least we can remove whatever the material is there present over there so that he will not have a further problem, further complication. Ultimately, those patients' relatives agreed with that. Then I talked with Dr. Nitin Bhagli sir that shall I go for homeopathic remedy for this case? There is a medicine in our homeopathy for treating these types of pot spine, and I have shown him the literature over there. He said, why not, Prasad? Go for it. We'll work on it. We'll do the surgery, but we'll work on it. I know that he's already on 4 months ATT and not having little bit improvement, so nothing will going to work. So why not to try homeopathy? And he was operated next day, and before operation, the same day I started him on the DROSERA. I have given him DROSERA in 200 potency, few doses on day 1 and again on day 3. Day 2 he was operated. And after the operation, after nearly about 48 hours after the operation, he started moving his hands and feet. There was motion in the fingers and toes. And within a span of 7 days, he was able to move all 4 extremities, the upper limbs as well as lower limbs. And my sir, Nitin Vagli sir, asked me, yes, Prasad, this is only because of your medicine, because already he was on anti-tubercular treatment without any result, and it worked beautifully in that patient. So this was the very important aspect which I have tried over there with the help of Margaret Tyler's reading of the book of Margaret Tyler's DROSERA. And this I have confirmed even in my practice, a case of tuberculosis treated with allopathy, but having lot of pain and not covered even after 8 to 9 months of ATT. And I have started him again on the same remedy. And again, he was recovered and able to move. Just 2 years back, I have treated this case. So these are things which one overlooks regarding the DROSERA routine. And that's why my suggestion to all of you that understand this remedy with all its aspects and not considering only a whooping cough remedy or a dry cough remedy. This is a remedy which is having a depth of tubercular miasm. So even the cough, the thesis, the laryngeal thesis, the lungs thesis, all those things which are quite common with this remedy are there. And that's why we have to learn this remedy from the Allen's keynotes. Let us open the Allen's keynotes and see what he says. DROSERA rotundifolia. Sundew, that is the common name, and family is Droseraceae. Whooping cough with violent paroxysms which follow each other rapidly and is scarcely able to get the breath. So see what he said. If the cough starts, the paroxysms are so fast that he cannot get a breath. He cannot get time to breathe. That much severe spasm of whooping cough are there. Wakes at 6 to 7 a.m. and does not cease coughing until a large quantity of tenacious mucus is raised, coccus cacti. So this is very close to the coccus cacti where both of remedies are having the severe cough, dry cough and whooping cough. But coccus cacti patient wakes at 6 to 7 a.m. and does not cease coughing until a large quantities of cough is expectorated, vomited, and then patient feels better. That is coccus cacti. There is one more point which he has mentioned regarding the indigo remedy. There is profuse epistaxis during every paroxysm of a whooping cough, then it is indigo. So whooping cough associated with epistaxis, indigo. Whooping cough associated with expectoration or vomiting of mucus early in the morning, 6 to 7 a.m. is the coccus cacti. And third thing which he mentioned over there is related with the Corallium rubrum, a remedy for post-nasal drip. Minute gun during day, whooping at night. So daytime some cough comes like a gun, a thrown which has been forcefully thrown away. In a minute, small droplets of the cough comes out, and the whole night it is whooping, nothing comes out. And that is what is the Corallium rubrum. So three remedies he has compared to start with the first paragraph of the DROSERA. And these we have to understand. These differences which are very important to understand. How to differentiate the DROSERA from coccus cacti, from indigo, from the Corallium rubrum that he explains over there. Then he goes for the next paragraph. There is a deep sounding hoarse barking cough. So it is right from the chest, from inside, very hoarse barking cough. It irritates you because that sound is very hoarse, like verbascum, another remedy. But verbascum having more action on ears along with that. Verbascum, there is a problem of eustachian tube in verbascum. So verbascum, it is not plainly whooping cough like a DROSERA. Deep sounding horse barking cough aggravated after midnight. That is the very important time modality. During or after the measles, whooping cough persisting after the measles, think of DROSERA. Cough spasmodic with gagging and retching and vomiting. So there is sensation as if the whole throat is absolutely obstructing the whole throat. There is a retching, patient wants to take it out, the mucus is there, patient feels it is choked up, and that choked up sensation brought him a vomiting sensation. Along with that, he has compared the Bryonia and Kalika, both remedies which are having a stitching type of pain. But Bryonia is full of phlegm in chest. It is pneumonitis, which is common with the Bryonia, with stitching pain. But Bryonia is patient where the right-sided lung gets affected over there in the pneumonia. And Bryonia is having very typical stitching pain associated with typical thirst and associated with a modality aggravated by lying on opposite side, better by lying on same side. Kalikap is exactly opposite in modality. Then constant titillating cough in the children. Constant titillating. Titillating means causing an irritation, whatever, irritation in the throat. Constant titillating cough in children begins as soon as head touches the pillow at night. See, very important thing. Whenever patient tries to sleep and keeps his head low on the bed, the cough starts. That is very typical with these three remedies. The belladonna is there, the hyoscyamus is there, the rumex is there, where there is this symptom very commonly comes out. Nocturnal cough of young persons in thesis. Nocturnal means cough is coming at night. Cough is appearing at night in thesis. Thesis means tuberculosis. There are two words, thesis and consumption for tuberculosis. So nocturnal cough of young persons in thesis, bloody and purulent sputa. If the sputa comes out, it is bloody. It contains blood tinged and purulent. The pus is also there along with that. So see, the tuberculosis is the very important entity in this specific remedy. Tubercular miasm is dominating miasm in DROSERA. There was one question, sir, can you repeat that what is minute gun? Minute gun means very small droplets which comes like with speed. Whenever patient comes, they thrown away from the mouth. A very small amount of phlegm comes out. In case of Kali cup, it is a big. Kali cup also, whenever comes, the cup is expectorated, thrown directly. But in Kali cup, it is of a big quantity. Here, it is of a very minute quantity. That is the difference. Cough aggravated by warmth, cough aggravated by drinking, cough aggravated by singing, cough aggravated by laughing, weeping, lying down, and after midnight. See the modality. Modalities are very important. Warmth also aggravates, drinking also, singing also, laughing also. So every activity the cough gets aggravated. Weeping also causes the cough. See, this is very important. Weeping also causes the cough. Cough is aggravated by lying down and even after midnight. So this is one important thing where you have to concentrate. Midnight aggravation. It looks very close to the arsenic album, but here arsenic album, it is more of a asthmatic attack. In DROSERA, it is more of a whooping cough. During cough, vomiting of water, mucus, and often bleeding at the nose and mouth. See, during the cough, whenever the patient starts coughing, there is vomiting of water as well as the mucus, and very often bleeding at the nose, nasal bleeding, and bleeding from the mouth, like cuprum metallicum. In cuprum, there is a spasm. Whenever patient coughs, his whole extremities they goes into spasm during coughing. That is cuprum metallicum cough. So whenever he coughs, he stretches, or there is always a movement of whole body. Jerks are there in cuprum metallicum. Sensation of fever in larynx exciting the cough. There is a sensation of irritation in the larynx, and because of which the cough gets aggravated, and that's why talking, singing aggravates the cough. Disease is prevailing during epidemic pertussis. Epidemic pertussis. So pertussis started and then it goes on affecting many persons at a time. That type of epidemic where DROSERA is a very wonderful remedy as a genus epidemicus also many times. Clergyman's sore throat. Clergyman's those who used to give who used to talk a lot, who talks on religious subjects many times, and who are public speakers having a sore throat. Clergyman's sore throat with cough with rough scraping, dry sensation deep in the fauces. It is very close to the hepar here, but hepar is too chilly remedy. Clergyman on sore throat, hepar is there, argentum metallicum is there. But every remedy has its own impact. Here it is rough scraping, dry sensation deep in the fauces. Voice is hoarse, deep, toneless, cracked, requires exertion to speak. Like Aram Trefal, we have read and learned this remedy a week back. Aram Trifalum, there is yes, whooping cough is there, there is a sore throat is there, the irritation is there, but it is associated with the nasal acrid discharges causing a corrosion over there of the nose, nasal folds, upper lip over there. And most acrid type of discharges are present in Aram Trifalum. Constriction and crowling in the larynx. See, there is a constriction in the larynx as if there is growling in the larynx, it irritates, there is hoarseness, and yellow or green sputa. Sputa is having color like yellow or greenish tint. Laryngeal thesis, tuberculosis of larynx, wonderful remedy. Following whooping cough, bronchial catarrh, following the if laryngeal thesis after the whooping cough, it is DROSERA. If there is laryngeal catarrh after the whooping cough, it is coccus cacti. Relationships complementary to the Nux vomica, acute remedy. Follows well after Sambucus, the sulfur and veratrum. So this remedy is well followed, well follows by Sambucus, sulfur and veratrum. And this remedy is well followed by Calcarea, pulsatilla and sulfur. These are three remedies which you can utilize after the DROSERA. Calcarea, yes, definitely it works. Sulfur also definitely works. If you have treated a whooping cough with the dose of DROSERA, and after 7 days, 8 days, patient comes in order to stop it completely. And if you feel the background is not only the tubercular, but it is also having the soric tint more, then give the sulfur as an antidote, as sulfur as a complementary. Compare Sina, Corallium rubrum, Cuprum metallicum, Ipecac, Sambucus in spasmodic coughs. So these are all remedies where the spasmodic cough is more marked. Often relieve the constant distressing night coughs in tuberculosis. So whole night patient is coughing and it is so much distressing. Specifically in tuberculosis, this remedy is a wonderful remedy. And now there is the answer to your question for Amit. This one should read. Hahnemann says in Materia Medica Pura, one single dose of the 30th potency is sufficient to cure entirely epidemic whooping cough. The cure takes place surely between 7 and 8 days. Never give a second dose immediately after the first. It would not only prevent the good effect of the former, but would be the injurious. And this is very, very important. This thing one must know. These are the hints which are given by those stalwarts are very important in our practice. DROSERA is very defective remedy. Many people consider this remedy as an acute. No, it's not acute. It has in-depth action, and that's why DROSERA never requires a repetition. Few doses and stop DROSERA. That's all. Nothing to go on using the remedy, and wait for at least a week. Then you will see the better effects of the DROSERA. So whatever Hahnemann have said about the doses is very important, and one must keep it in our mind that DROSERA is the remedy one should not go on repeating unless and until it recalls. And it's whenever you have to give it for the bony complaints, go for a little bit higher, 200 or 1 potency, that will be used. Yes, 3 doses at interval of 15 minutes is nothing but the same. That means you are giving 1 dose. If you are giving 4 pills every 15 minutes, it never becomes that you have given 30 plus 30 plus 30 is equal to 19. It is 30 only. So you should not, that is not matter. If you give 3 doses, that is a single dose. but don't go on repeating it longer time. That is the question. If you are giving it today, tomorrow, day after tomorrow, should not. There is no need. If if you would have given 3 doses, that's all. Wait, nothing is required. So these are things which he mentioned about the DROSERA, and this is very, very important practice remedy, not only for whooping cough, but also for pot spine. Keep this remedy in your mind. So we have learned DROSERA from this book. We have to learn spongia, very close component of the DROSERA. So we'll discuss spongia in tomorrow's session so that we'll have both remedies of a whooping cough at a time. So that's all for today. If any query is there, we have a chat. Otherwise, we'll conclude.
Sir, then why 3 doses are given? Single dose is sufficient. 15 minutes interval, single dose is sufficient.
Just a minute. If you repeat 3 times, it never becomes a 3 doses. What is need many times a patient who is addicted to certain things on repeating the remedy for 2-3 times, it will antidote the effects of those addictions also. It removes, and if because of that antidote, if a patient is tobacco chewer, patient is coffee taker, those many times it never gives your remedy to work when you give single dose. For that purpose, it is needed to repeat it little bit. But what it is a dynamic. If you are giving 33 doses every 15 minutes, remains 30. It will not act as a 31. It will not act as a 90. It will work as 30 only. So it is always better to give 3 instead of 1 so that that stimulus remains persistent. Many times it might get antidoted, and that's why it is needed to give it 3 times. Actually, this is the reason. It is not, it never means that it increases the potency. There is one question by Shahrukh. What is the question? That complementary and followed well difference? Yes, complementary remedy is the remedy which completes the action of the previous remedy. For example, if you have taken the rust tox, you are feeling well, your acute state is covered, but not you are not it completely cured. It recurs after a week, after 10 days. Then you have to complement it with calcarea carb, and it completes the action of rust tox and finishes, and then patient is completely cured. This is called as a complementary remedy relationship. Follows well means that after rust tox, sometimes some symptoms comes with which you get another remedy over there. For example, we'll take into consideration the same remedy, the Rustox. And if you open the Rustox in Borix Medica, at the end, you will find there are follows well remedy. And you will find over there there is a belladonna also, which is there in the follows well. Patient comes to you with a severe body ache, fever, etc. And patient felt better, but his sore throat is not going away. And you have seen that throat is congested a lot. Now, here it is not an acute state, it is not a chronic state like a calcarea, but his throat is congested acutely and which is not covered under the action of rust tox. Then you have to find it out next remedy, and if you find it is belladonna, give the belladonna, belladonna will cover that completely. After belladonna, patient still feels better, but not yet completely recovered, not get strength. Then you can complement it with the complementary of belladonna, and it is the common complementary for belladonna and rust tox is calcarea carb. Then the action is completed. So there is a difference between the follows well and the complementary remedy relationship. Is it clear? Okay.
Yes, sir. Thank you, sir.
Okay. So we'll conclude today's session. Tomorrow we'll meet with the spongia, and in the evening at 5:45 with the philosophy session. Thank you very much. Thanks a lot.